nervous, confused, and hopeful.
Isolated, sad,
very serious, very bittersweet,
uncertainty, fear,
curious,
scared, anxious, and lonely.
Stressed, lonely,
tired because I sleep all the time.
Makes me a little nervous,
anxious, scared, and kind of confused.
Lonely, bored, and unhealthy.
Irritated, bored, I kind of feel claustrophobic.
Definitely concerned.
Frustrated, overwhelmed,
confused, and in shock because it happened so fast.
Upset, stressed, and a little bit unproductive.
Scared and, I guess worried.
Overwhelmed, persistent, and hopeful.
One of my parents is like going through some stuff right now, like, so I'm just worried about like losing them to this disease because I don't know what I'm going to do without my parents.
My sister works at a grocery store. My mother works at a hospital.
I'm afraid of me getting it and being like a carrier and affecting someone else, like my mom or my sister. I'm afraid especially of my great-grandmother and great-grandfather.
I was worried about my stepdad getting it because my stepdad has cancer.
I wasn't too scared till yesterday because my city has had 5 deaths. So, and I have a low immune system, so like, it scares me.
Some people in my family still work because they are considered essential workers.
I mean, I'm kind of worried about my grandparents. Just because they're old and they have health issues. Both of my parents are quite a bit older than most people's parents my age, and they are in the age range where they would be at risk, like higher at risk.
My mother is diabetic. If I get it, I just hope I don't have I hope that I'm not forced to be in a hospital.
It's not easy to come back and be quarantined for some people in their houses because it's not a good place for them.
I definitely miss my friends. I'm doing everything I can to stay sane in this house.
I don't get along with my family, so it's kind of hard.
Can't really go anywhere because 1, the virus, 2, my siblings don't have school, so I stay home and help watch them.
Being in one space with 9 siblings at the same time is insane. I'm normally at home a lot, but the amount is kind of getting difficult.
I miss my friends and I miss school. I'm stuck in my house with my family, so it's kind of making me go a little insane.
This coronavirus has a decently big impact on my mental health. I know my anxiety is peaking.
It's sometimes hard when you're at night and you're just you're alone with your thoughts and you're just thinking about it.
I think for anyone really with a mental health problem, the thought of being stuck inside for a long time is kind of scary because I feel like that's something that if you do have an issue, that's kind of what you end up doing.
A lot of not knowing things, which is really difficult to handle because we all like feeling in control, and this entire situation is just totally out of our control.
I'm afraid to look at the news channel.
But now it's affecting everyone. No one's really protected from this.
The fear of the unknown or when things will go back to normal.
School's getting pushed back. The people who are supposed to graduate this year might not get to graduate. You might have to go for a couple more months.
People were kind of coming out and saying oh no, I don't know what I'm going to do. I'm quarantining is kind of scary.
It's a whole mess.
When you're not mentally healthy, your physical health will decline too. I did all my physical activities at school.
I am an athlete. I'm never at home. I'm always at school, at practice, or doing something else. So being at home has really stressed me out.
People being alone and not having that social interaction really can bring back some bad thoughts and stuff.
We're trying to get a therapist, but with the situation that's going on right now, I'm not sure if I will get one anytime soon.
Just the things going on inside my head about it is just a little bit stressful.
I've been eating more junk food. That's not good for me, but I still do.
Eating and sleeping are 2 good ways to pass time.
I've been very unmotivated because there is nothing really you can do, so why can't I just sleep all day?
Not having any social interactions or even with my family, with nobody else around me, it just it's lonely, yeah.
It's definitely impacted my mental health because I was at a program and my mom decided to not let me go there anymore because of the coronavirus, and I was just starting to get comfortable with the people and just starting to, open up a little more.
One member in my group was talking about like how not seeing their friends has kind of made them more depressed and everything, because although you can FaceTime, it's not the same as talking to people.
Lots of people that have mental health issues, when they're stuck in isolation, it makes it worse. And that worries me a lot for other people and for myself.
This pandemic is definitely causing some of my depression to come back, and it's difficult to manage.
I can't really do anything. I do feel kind of that just overhanging gloom.
A recent survey done the last week in April by the ACLU Youth Committee asked more than 450 students from 49 districts in the state of California about their mental health. Over 50% of the students who responded to the survey say they're in need of mental health support since the school closures began in California in mid-March. They're stuck in small apartments, cramped apartments. They're stuck, in some cases, with abusers. They're stuck with people, parents or caregivers who have substance abuse issues, and they cannot leave.
For a lot of teens who are in trouble, the families are one of the causes of the trouble. And so around the world, we've got teens who are isolated with the people who offer the biggest challenge in their lives. What they really need in that situation is an outlet, is a way to talk. One of the things that I've noticed is that for a lot of teens, being in isolation has exacerbated the problems that they've already had. Teens in trouble, teens with mental health, often rely on something to give them structure in their lives, and for a lot of them it's actually just the routines of school. They may not like school, but school has a routine.
Anxiety is higher, and many teens are depressed. They're lonely. They're grieving. Long list of things that people are worried about, and teens among them, including, will somebody I love be sick? Is my family going to be okay? Economic worries. What's going to happen on the streets? Are we going to have a civil war? Are we in a civil war? The anxiety and fear is very real right now. Kids have grief that they lost their graduation. And one thing that we noticed, and one thing that we care very deeply about, is not minimizing any loss that anybody has. It may not be the death of a loved one, but that practice, that event you were practicing for 6 months, and all of a sudden it's gone. There's no opportunity to have it again, and you're now in another grade, or you've left high school. It's very powerful. It's very powerful. It's a very powerful loss for kids, and it's important that we recognize it.
Not knowing what may happen is a lot worse than planning for what we know will happen. And then for the teenager, I think that is magnified 1,000 times, because they're experiencing all of us feeling like we're, a little off teeter, right? And so they're picking all of that up too, in addition to what they're going through themselves. They're hyper empathic at this age. They're very alert. Their neurons are just growing and expanding. They're already in a kind of place in the world where they need a lot of stability, right? A safe place to be held. And if the adults in their life, not even their immediate adults, but if the adults in this entire world, including, scientists and researchers who have studied coronaviruses for the past 20 years, if they don't know the answer, that really trickles down to just feeling very, very uncertain about, well, I don't know what's going to happen to me.
I have episodes, I like to call them, where it's kind of in and out depression episodes, or sometimes mental breakdowns, and I just start crying.
I was just diagnosed with Crohn's disease, and my family wasn't very understanding.
I struggle with a lot of anxiety and depression.
Just not feeling like I fit in.
I've struggled with mental health before.
I was sexually assaulted last year.
Yeah, I've been suffering from depression for 8 years and anxiety for probably around that much.
I have anger issues. I have like a major depression and then anxiety, and then recently I have PTSD.
I have severe anxiety, and I also have a lot of panic attacks.
As teens, we go through a lot of anxiety. Personally, I was struggling with my own identity.
I have major depressive disorder, which is just depression, generalized anxiety disorder, social anxiety disorder.
Give Us the Floor is a really powerful tool for young people to support their mental health and wellness and adolescent development. It's a peer-to-peer service where young people can talk to each other, support each other in the ways that they're accustomed to, in language that they're accustomed to, and connect them with resources when they're in crisis. So these young people need Give Us the Floor. They need a place where they can go and where they can find community. It's safe, it's trusted, it's supported by trained peers who run the groups.
I'm proud to be on the advisory board of Give Us the Floor. I think it was a wonderful creation of a destination for teens to be with each other, to get support from each other, to get comfort from each other, and to find answers. And for many years as a psychoanalyst and working in the space of social media with Facebook and Google and other platforms from the Yale Center or with the Yale Center for Emotional Intelligence with my colleague Mark Brackett, we heard from teens over and over again as we ran focus groups that they didn't want to talk to adults, particularly when they were upset. I shouldn't say that. I shouldn't say they didn't want to talk to adults at all, of course, because teens still need their parents. They need their families. They need the comfort and stability. And they need each other. And particularly during times of stress, teens wanted to reach out to each other. Maybe to somebody a little bit older, more experienced, maybe not, maybe just to their closest friend who they felt might have more wisdom than they, or just a hug. Now a virtual hug, but a hug nonetheless. And I think without that outlet, teens are lonely. They're lonely for someone who really understands them. So we know that at any age, it's a basic human need to feel seen and understood. And teens feel seen and understood when they're talking to other teens, because they're going through the same developmental struggles. It's a time that they're launching. It's a time they're looking for identity. They're finding themselves, and they're finding themselves in their interactions with peers. Most importantly, it's a time where peers are everything. And in this time of stress, with COVID-19, with the murders, with racial tension, as I was just talking about, peers are everything to teenagers. And that social connection is the number one pathway to building resilience. And at a time where we are going through unprecedented, tough time, challenges of anxiety about illness and fear of the world that you knew all of a sudden is upside down.
Community and dynamics and generational dynamics are more important than ever.
The teenage years are particularly an important time for social connections. The research that I've really been honed in on sort of identifies this idea that the human species, we actually have to learn to grow our friendships and relationships. And I think having a community online is often a bridge where they can feel safe. And then I think the ultimate goal of all of this is that when you give teens the space to, in a healthy, positive, happy way, to figure out what their ideal friendship is for them that makes them happy, they then know how to take that into the real world. Teenagers feel things first before they can make sense and articulate it. And when you feel something so strongly, I think the kind of internal sort of immediate human emotion is to go inside. And oftentimes, they have to learn to kind of reach out and to bring themselves out there and to sort of let these feelings kind of come to the surface or come to the front of the mind so they can articulate it. Having had these online communities is actually a bridge and kind of a stability.
A lot of the time they will think that it's just them, that they're the only person who's going through this, that they're the only person who has ever experienced this. And to find out that others go through the same thing, it's validating, it's reassuring.
If we think we're going through everything alone, if we can identify with that other people are going through things with us and struggling and can relate, it really helps us process. There's nothing that an adult can bring to the table sometimes.
Just having a support group, being able to be there for you in like times like this where everyone's just kind of alone is really nice.
It's been kind of hard being lonely, stuck in the house. So it's definitely been a lot more important to have my group chat.
Having the group chat is definitely a good outlet because you can talk to people and we don't have to worry about social distancing or not seeing each other in person because we never did to start with. My group has definitely been talking about the coronavirus a lot and a lot about how it's been affecting them. I definitely feel like the group chats are more needed because I've definitely seen a lot of people post that they're feeling super lonely. And I mean, I'm feeling lonely.
It's nice to have an outlet to talk about anything that's bothering you.
My group chat has been the one stable thing that's really stayed stable in my life, which I am so grateful for. Whether it's at 10 in the morning or 2 in the morning.
Like, even though I'm a facilitator, I get a lot of support from them, and they've been telling me kind of things that have been working for them to keep them busy at home, and just letting us know, like letting me know that they're here, and it's nice to hear that because like with the people I know in real life, it's hard not being able to see them, but I've never seen these people, so the relationship just feels the same.
It's very much peace of mind that you know that these people are always there, and even through this, you'll be able to talk to them.
The goal for Give Us the Floor is to provide a safe space and to create your own little community with other teenagers.
It just feels like a very inclusive community and people aren't judging you. It's a safe space where you can go to talk about any of your issues and make sure you feel like you're being heard.
It connects us with others that have the like interests, so we're able to connect with them and talk to them.
There can be so few places where people can actually have a safe place to feel and know that it's okay to feel these things. And I feel like Give Us the Floor really urges teens to be able to communicate their feelings effectively.
If you need somebody there, Give Us the Floor is there.
I don't feel isolated like I would be, and I know that there's friends that I can reach out to.
It just kind of makes you feel less alone when you're alone and gives you the feeling that you're able to talk without being judged, or you don't have to see the person that you vented to the next day and have a huge regret about it.
It's important because then teens can still get their feelings out when they can't like talk to anybody else.
They were taking their anger out on her, and she just felt so like scared and trapped and just kind of like in her own little bubble, and she felt like she couldn't do anything. It was probably like a half an hour that I was talking to her, and a couple of other members were like joining in, but in the end we actually got her to like get up, take a shower, which she, you know what I mean, like eat a little something, drank some water. I was like, thank you, and she was like, it's only a little bit and my stomach hurts now. I'm like, that's okay, you got something in your system, like it will be okay. If you can do a little something, you can do a little something more later too.
Confidence, friends, support, joy,
happiness, and motivation.
Sense of belonging.
Purpose, connection, and support.
Hope, selflessness, and respect.
Support, friendship, and help.
Compassion. Happiness. Support.
Support. Definitely.
Positivity.
Hope, love, peaceful mindset.
Joy, friendship,
empathy, communication, community.
Compassion.
Helpful, inspiring, and I'm grateful for it.
Loved and supported.
kindness,
acceptance, relatability, opportunity, and hope.
Comfort, and honestly joy, just because I get to be able to help other people as well.